Good. Okay. So thank you so much for taking some your precious time. So let's start with a very general question, in that as we all know that more than 1 million people are affected with COVID-19 and more than 50,000 deaths are on the record. So just generally, just for the audience, how does it spread, and what are the best messages we can give to our public?
Yeah, well, it's spread by people coughing and sneezing and onto the surfaces of people, surfaces all around, you know, doorknobs and other things, which mean that, in other words, you can pick up the virus by touching surfaces. And so that's why, you know, it's so important to wash your hands frequently and do so in a way that, you know, take some time washing your hands very carefully and doing so often, because the virus is being coughed out and sneezed out in droplets and landing on surfaces. And if you are sneezing yourself, you need to sneeze into a tissue or into your sleeve like this, and then washing your hands very carefully afterwards, throwing the tissue away. So those things are incredibly important. You know, this business about wearing a mask is, there's not evidence that helps you to prevent getting infected. They are very important for health workers and for people who are ill with the virus and minimizing spread to other people. So the main thing is washing your hands very carefully, especially when you've been out and touching surfaces. Out of the home, that is.
So yeah, it's really important, and that's what the message we are trying to convey to the people as well.
Yeah. People may not understand why soap is so important. You know, soap dissolves the surface of the virus because it's a lipid. It's like fatty surface to the virus. So soap and water is really effective, more so than the gels. Though gels are good if you haven't got water to hand.
Okay.
Yeah.
So while the number of affected persons in Europe runs into tens of thousands, the number in Pakistan is still around 2,500, like which are the recent figures, which is comparatively very low as we look at the all over the world. Like it is, it's so bad. What could be the reason for that? Like in your expert opinion, what is the Pakistan's COVID-19 numbers or cases are so low as compared to other countries?
Well, you know, it depends on when the virus arrived. So obviously it started in China. So the big increase in cases happened very quickly in China, and similarly in Europe, like Italy. And then it arrived in other countries, such as Pakistan later, from Iran probably. And so you're at an earlier stage in the curve, but it will increase just the same as in these other countries. There's nothing special about Pakistan in terms of having a low number of cases. You'll have the big number of cases increasing every 3 days or so by double up.
Okay.
Horrible situation. And the other thing is that you've got the number of confirmed cases are few compared to the actual number, because most people that have got it, they've been ill, but they haven't been tested. They don't know.
So you are like in your calculations, you think that the Pakistan's number would be really high. I ask this question because there is a myth surrounding this, that because South Asian countries, we are already exposed to so much viruses and infections that probably we had that immunity and the malaria vaccination which we give to the kids in the childhood.
This is a new virus spread by eating animals from the bush, keeping them alive and getting infected by a bat, etc. So these are new viruses. They're not ones we've had before. We're all susceptible to this virus.
Right. So there is another common belief that old people are more vulnerable to COVID-19. And it's because so far the research or the cases which were coming particularly from Italy and China, that most affected were the older peoples, older adults. So do you think this message has some research-based evidence, or are young people less likely to be affected with this COVID-19?
Everybody is susceptible to catch the virus. The difference is in how ill you get. Children rarely get ill. Young adults usually get a mild illness, some cough, some flu symptoms, but not very bad. Older people are more commonly getting very ill, and especially so if they've got other diseases such as diabetes, high blood pressure, heart disease, and other diseases, chronic diseases of the lung, for example, if they're a smoker and they've got chronic lung problems. All of these people are much more likely to get more severely ill. So in other words, don't feel that it's a difference in the likelihood of infection. It's just you're more likely to get ill or severely ill if you're older and if you have these chronic diseases.
Mm-hmm. So you essentially means that the young adults are also are not invincible, but they the probability of getting serious illness with COVID-19 is less as compared to the small as compared to the elderly population.
Exactly. So a young woman like you is less likely than an older man like me. But I don't have chronic diseases. I'm not diabetic. I don't have kidney disease, etc. I've never smoked. I'm less susceptible than other older people like me.
Okay. So, but does even like if the young adults, probably they will be asymptotic, like they don't show that much, symptoms. But they are the carrier of COVID-19. Okay. So what?
Yeah. Anybody who's ill with symptoms, as soon as they start, day one, they start feeling ill, even a little bit before, they are spreading the disease. That's why we have to cough into our sleeve or into tissues and throw them away and wash our hands incredibly carefully, all that with soap and water so often. And because we will spread it, for example, to members of our family. And especially to older members of our family.
That curve is somehow different. In recently we saw that more than 24% of the cases are between the ages of 21 to 30. So that's
what you'd expect.
Okay.
So that's not surprising, and it depends who you're testing. So different countries have different testing policies or availability of the tests, and somewhere like Pakistan has limited availability of the tests. So there's a lot of people out there who are ill, infected, and are not being tested. And same here in Britain. So, depends who you're testing. But young people, yes, if you test them, many of them are infected already because the virus is out in the community spreading. So across Pakistan, so yes, we expect those young people to be infected. But for sure, everybody is susceptible.
Okay, so if we look at the Pakistan's health system, which is already very fragile, would the country be able to cope with the problem if the virus spreads here as it does in Europe and the US? What is your expert opinion?
Yeah, I mean, it is going to spread, and that's clear. And it'll double every 3 days or so in Pakistan as elsewhere when it takes hold in the spread through the community. So at the moment, as in other countries, as here, the first idea is to put special beds, extra oxygen and ventilators. And of course, that's important. But as well, we need to have guidelines written and training done and supplies provided for protection of health workers throughout the health system across the whole of Pakistan, in every district or tehsil health headquarter hospital, in your rural health centers, your basic health units, your private facilities, everywhere will need guidelines and training orientation. That could be by an app. You can send the messages out on their smartphones, etc. But the point is, we all need, everyone in Pakistan needs to be ready for people coming to see them with cough, with fever, flu symptoms, short of breath. But these are common symptoms. So we have to treat whatever the cause is, which might be the usual causes, but it also may be this new virus, COVID. And we have to treat them as their existing disease, which it might be. And we have to give them advice on self-isolation at home and this very careful hand washing and keeping 2 meters apart and all that to avoid spreading it to others in your family.
Right.
So everybody needs to be involved from now on.
Okay. From the individuals to the government. So,
Yeah.
on this question already, but I just want to make it more clear. You give us some more expert opinion. Like, what should be the strategy of or framework for Pakistan government that they should adapt to fight against this pandemic? For example, how
you've got
services.
you've made a good start with the extra beds and quarantining places and hospital beds with ventilators, things like that. So that's important. But most patients are ill for the first week without needing that. And they need to be cared for. And the prevention that I was describing so that they don't pass it on to other people. If in the second week they get very breathless, which maybe 1 in 5 people do, especially the older people, etc., then those people will need to go to hospital and be cared for in those beds. But the numbers will be so huge, every hospital will be involved. Not every ward, but every hospital. So it's going to be, we have to rapidly now gear up the whole system to be ready. And of course, everybody, the people have to be aware and telephone for advice, etc. And be aware that if they're ill, they may be okay for a week, but may get very breathless, very difficult breathing the second week, in which case they need to know where to go and go quickly for that extra help that 1 in 5 of us will need. Okay. So it's all of us need to be informed. All of us, meaning the whole Pakistan population. I consider myself somewhat Pakistani. I've worked for 20 years with some wonderful doctors and health workers in Pakistan, and I love the country of Pakistan. And so I'm very concerned and hope that you get into gear quickly for this.
Right. You also talked a little bit about this, like because we don't have much trained human resource. So you suggested that we should use the cell phone and different apps to train them. Am I right?
Yeah. Yes, because it's very difficult to get that training and the guidelines, the new guidelines, which incorporate together with the usual illnesses that are related to fever, cough, shortness of breath, as well as those illnesses, the COVID, what to do with the people that may be COVID. They may have malaria, they may have asthma with infection as well, a different infection. So we've got to treat them for the usual thing and that they may be COVID, because the test won't be available everywhere and not very quickly. So, we have to treat them as possible COVID. That's the new virus.
The best.
So my point is that every health worker has to be able to do this, and every person needs to be ready for this advice on what to do. It's a big job, but you've got a lot of health workers out there. You can't just use the ones who are in the specially designated hospitals. Of course, that's very important, but we have to use all your doctors, all your paramedics, etc. stuff.
Yeah, like Pakistan can use the lady health worker and lady health visit.
Exactly.
The community.
You are very special. Pakistan has a very special and very much respected internationally lady health worker program. This is something very special that you have. You need to use it. You need to cherish it, nurture it, and use it in your hour of need.
Yeah. And last but not the least, you please highlight the role of experts like you and the public health specialists and institutions like PIDE in combating COVID-19, like what role we can play?
Well, very important role, but of course you have your own very capable specialists in country. I've had the pleasure and honor of working with some wonderful people in the health service, doctors, public health specialists in Pakistan, and regular health workers. So, you know, you've got people, good people there. So people like me are available to help, advise and assist, and in particular, because I'm working with other countries, and so I can bring examples and experience that can be examined by your own people and think, yeah, this makes sense in our situation. This is something we can use, or maybe no, that part is not so relevant to our context. So that kind of support to bring in that wider knowledge and experience and guides and tools that can be adapted and adapted quickly. And, you know, it's not just health people. I'm obviously a health person, but my wife is a health economist. They're very important people. Economists are, as are managers, what in the health sector, education sector, in the police, and you know, every sector's got a role to play in this, because it affects everything, including, as you know, the economy. So we need to keep people working as best they can from home. And when they can't work from home, that they're doing very carefully with hand washing and keeping 2 meters distance in the shops and so on, keeping the food distribution going, and so many essential activities that need to be happening. But we're also learning from this whole experience. We're learning new ways of working and so
on. Thank you so much, Dr. Walley. Walley.
on.
Walley, it's a pleasure having you. And I'm really grateful for your deep insight on this issue. And we would love to take you on board for whenever we need your help. And we need help from all of you. We'll be in touch with you for that. Thank you so much.
Thank you very much. My pleasure, Saima. Kuda Hafiz.
Thank you. Khuda Hafiz. Yep. Thank you so much. Thank you so much. Khuda Hafiz.
Bye.